Hi, it's Dr. Brad Guyton, and we're back with our Smile Power Hero of the Week. This week, we're joined by Dr. Katya Mauritson. She's the dental director at the Colorado Department of Public Health and Environment. Dr. Mauritson, thanks so much for joining us today.
Thank you so much, Dr. Guyton, and thanks to Delta Dental for this opportunity.
Tell us a little bit about your unique role in the state of Colorado.
Of course. So as the state dental director, my role is really to focus on the health of the state and communities and population health. And that work involves a lot of programs that prevent and manage chronic diseases. So we work in community-based settings like schools, we work on water fluoridation, and on interprofessional programs between medical, dental, and behavioral health, like our Cavity 303 perinatal program and our diabetes and heart disease oral health program.
Yeah, the stuff you guys do year after year is just astounding, and we really appreciate all the efforts from your team. Your role has become extremely vital in the last few months. Share a little bit about your perspective on the crisis and what's going on.
Well, as your whole network knows, oral health can often be something that is neglected because, especially during times of crisis, this is something that we are concerned about, that the communities that haven't been able to have good access to care are even having worse access now. And we know that untreated oral pain and infections can lead to very bad complications across the lifespan that can affect nutrition, social emotional health, exacerbate diabetes or other heart diseases, and they can also lead to death. So we're very concerned during the COVID crisis that we're going to have an increase because people can't access care as easily as they used to be accessing it. But we're actually very lucky that the Colorado dental community has taken the lead with the Colorado Dental Association, making plans and finding ways to help patients and providers get in touch with each other and get the care that they need before it becomes an emergency.
Yeah, no, exactly right. What about some of the highlights of what you've been working on specifically over the last couple of months?
Well, one thing that our department had been planning with the primary care office and the oral health unit was a scan of the dental workforce. And it was going to be right after we all recredentialed our licenses in February. But because of COVID, we switched those resources to really looking at what was the dental response to COVID and how many offices were still available to patients during the stay-at-home order. And we had over 700 dentists and others respond to let us know that they were still available and open to see either their current patients and new patients that might have lost access to their dentist. And that way we could really keep people from having to run to the emergency room during COVID and being afraid of going to a hospital, and being able to get actual definitive treatment in their normal dental office or with somebody else in their community.
Yeah, it's been impressive to watch the response of dental providers across the state really rising to the occasion and protecting themselves, their teams, and their patients. Forward a little bit, what do you see unfolding?
Well, there's a lot of great work being done, as you've already said, by our dentists and hygienists and the teams out there in the communities. And we think that the stuff that works for communities like teledental strategies and the new trainings that our dental providers are taking now to be able to triage over the phone and look at the patient's mouths over the phones as well has really been something that allows more community members to access care outside of the traditional dental walls. Some of that's going to stick, hopefully. And as we go into the planning process of our 5-year oral health plan, we're going to be looking for communities and for providers to tell us what worked for them. And we're going to work on really supporting that and making those changes that work more sustainable.
Excellent. Yeah, no, that's super encouraging. Is there any kind of story or kind of heartwarming thing that you've seen I'm sure there's so many examples of things that you've seen and been a part of in your role. Anything you would be comfortable sharing with us?
Yes, I'd love to. I just have to say that I'm not practicing anymore, but it has been really heartwarming to hear the stories from the dentists who, during the stay-at-home order, got a phone call from a frantic parent or as a patient themselves saying, I'm in extreme pain, we need to get in, and we can't find anybody to treat us. There have been dentists who have been open and have God left their homes during the stay-at-home order to take care of these patients, to keep them out of the ER and to get them out of pain. And it's been wonderful to be able to meet those people and to support their work.
Yeah, I couldn't agree more. Wow, what a great effort from you and your team, and we just wanted to thank you for all that you're doing during this time, and also to obviously all the dentists in Colorado that we're so familiar with, and all the great things they're doing as well. It's Dr. Katya Mauritson. She's our Smile Power Hero of the Week. Dr. Mauritson, thanks again for joining us today.
Thank you so much for this honor. It's great to talk to all of you.
Yes, keep up the great work and stay healthy out there.
You too. Thank you.